So welcome everybody. This webinar is about coronavirus infection control and risk management. It is a very simple run through about the conditions and expectations that Woodcraft Oak has of its groups and its districts as we plan to resume face-to-face activities. In this session, I will clarify how groups can manage infection risk, particularly infection risk around coronavirus. We will go through what's required practice for our groups to do before they resume activities, as well as what's recommended. Required you have to do to be covered by our insurance and to comply with government guidance. Recommended is just what we think is good practice and is not a requirement. And you will need to make the judgment about what's right for your group, your volunteers and your location. I will also share where you can get information, support and training as you begin to plan to do face-to-face activities again, and answer any questions that you have about infection control and risk management. To ask a question, just please use the chat facility and I will do my best to respond to your questions as we go through. So, first thing, this is an image we've all seen lots, I'm sure, of what a coronavirus looks like. The transmission of coronavirus is thought mainly to occur through droplets, whether or not we sneeze, cough, or spit at people, and therefore the things that we have left on the surfaces that we've touched after getting droplets on our hands and our bodies. If we think about that, which is why the rationale of face coverings, because we keep our droplets to ourselves. In terms of our infection control, our aim as event organisers for children and young people is to try and reduce the risk to children, young people, their families and our volunteers and members of the public in everything that we do. So we need to be really mindful of what risks the activities we are planning present to those who will be participating, as well as those who will be around us. It is true to say we cannot completely remove all risk, but we should take every step possible to reduce risk wherever possible. And there has to be a balance between the risk and the benefits. And it is true to say that the risk and benefit balance will be different in different communities and with individuals who have different support needs. As we have seen in England this week, Leicester has experienced lockdown, while other parts of England are opening up. So we also need to be mindful about what's happening in our communities at the time that we're planning our activities. The message very strongly is if we're in doubt, we should continue to deliver both remote and virtual programme and delay our physical activities until a time where we feel comfortable that we can manage the risk that is presented in our community. No volunteers should feel forced to participate or lead activities until they feel comfortable with that. And I think that's a very strong principle that we need to commit to throughout this period. When we're looking at infection control of our participants, we're recommending that people book. We have to keep a register so we know who our participants are. And we need to make sure that our participants are free of symptoms. And those symptoms include temperatures and coughs. There's a loss of smell as a symptom. You can find a full list of associated coronavirus symptoms on the NHS website. Now, I'm not expecting group leaders to take the temperature of children and young people, but I am expecting us all to confirm with individuals and with families that they are free of symptoms and they've not had contact with people with symptoms before they attend physical group activities. The other thing that we're going to be doing is focusing on small groups, so only having groups of 15 young people. So no large gatherings are going to be permitted for the short term. When we can return to large gatherings will depend on government guidance. At the moment in time, they are saying that we should not gather in groups of larger than 30. The other advice very strongly from Public Health England is that we manage good hygiene. and that we have signage to remind people about how to do coronavirus prevention and how to do hand washing. You will find template posters around hand washing and coronavirus prevention on the Woodcraft Vote website at woodcraft.org.uk/COVID-19-reopening, and you can download those and print those. We highly recommend you display them. We also require all groups to do hand washing on arrival, before eating, and on departure. The idea there is that we clean ourselves of the virus before we start interacting with each other. We clean ourselves of the virus before we start putting our hands near our mouths, and we clean ourselves of the virus before we go back out into the world. We've all heard that we should be cleaning our hands while singing happy birthday or whatever song that we like, as long as it lasts for 20 seconds. Ideally, we should be hand washing with soap and hot water, but if we can find hand sanitizer, alcohol based, we can do that outside. We should be providing tissues, and we should be providing a bin to dispose of our rubbish to make sure that all of that contaminated waste is not left lying around. They are recommending that we have paper towels, or that individuals bring their own hand towels to dry their hands rather than just wipe them on their trousers. The other thing that we need to be really mindful of is shared facilities. Now, the recommendation is that we should reduce shared facilities wherever possible. Woodcraft Folk is recommending that in the short term, our face-to-face activities are outdoors, where there is greater ventilation and there is a lower risk of infection passing from individuals. We recommend that there are no shared equipment or tools, and that we should be focusing on activities that do not require us to have specialist equipment. The other thing that we are requiring is that activities should not last more than 2 hours. The more time we spend with each other, the greater the risk of passing on the infection between participants. We recommend that kit lists are issued to individuals before they attend, so that they bring everything that they need with them in advance, things like a drinks bottle or a snack, or if we are going to have equipment that they can bring from home. But ideally, we can play games and activities that are light on equipment. The other thing that we're recommending is that we don't make snacks and drinks, and that we consider naturally packaged snacks like bananas and oranges rather than creating additional litter. And the other thing we have to be really careful of is recognising the risk of doing first aid. We need to be prepared to do first aid. If we're running around outside, there are situations where children could have accidents. To help us do this, we clearly can't give first aid in a socially distanced manner, but we will need, therefore, additional PPE. We are recommending that in your first aid kit that you have gloves, aprons, face mask, and some sort of face shield or eye covering. Your first aid kit should already have some of these in anyway, but we're advising you to purchase some extra equipment for this period where there may be a risk of the first aider being coughed upon, and therefore the infection spread between the person requiring first aid and the person who is giving them support. Now, this is where I want to be really clear about what groups are required to do. Now, lockdown is being eased differently across the UK. From the 4th of July, in England, sports, leisure, social and cultural activities can begin, although there will be some geographical areas who have local lockdown restrictions. Woodcraft Folk activities are classified as sports and leisure, cultural and social. We're expecting those activities to be permitted in mid-July in Scotland, but they currently aren't permitted at the same time as England. Whilst we're in this phase, all groups must complete a risk assessment for the activity, their venue and individuals before activities take place. There is an example risk assessment on the Woodcraft Folks website on the COVID-19 reopening page. All groups need to display signage, and that signage should be reminding them about coronavirus prevention, social distancing, and hand washing. All groups need to provide hand washing facilities. If we can't provide an opportunity for people to continue to carry out basic hygiene, then we shouldn't be doing the activities. All activities should only involve small groups, so 15 children and young people at the most. All groups need to have a register. We need to know all of the adults and the young people who've participated in that activity, in case somebody develops symptoms after the event and we need to go back and do some of that track and tracing that we've been hearing so much about in the media. All groups are required to do social distancing. Even when we're outside, we should be keeping 2 meters apart wherever possible, and all groups need to have additional PPE in their first aid kit. This is required practice that you are required to do to be covered by our public liability insurance. And this, we believe, is the best practice to try and safeguard children and people, volunteers, and the families and members of the public who may be around the group activity that you are planning. We recommend outdoor activities. From the 4th of July, it is possible to do woodcraft folk activities indoors, although the risks are higher, and therefore we recommend that our activities focus outdoors. We also recommend, particularly for our younger age groups, such as our wood chips, that these are family and household focused activities, as that will support the volunteers to maintain social distancing and reduce the demand on volunteers having to give personal care to our younger participants, or to give close supervision to our younger participants, because their household adults can do that for us. We also recommend that we use clan groups for activities, what the rest of the world is calling social bubbles at the moment. We recommend that recognise clan groups as a good practice. This would be 5 young people and an adult volunteer. We would recommend that that clan group is consistent every time that you meet for the short term. We would recommend that clan group tries wherever possible to keep siblings together if that is in the best interest of those siblings, to try and reduce the amount of household mixing. We also recommend no shared equipment. If you are going to share equipment, you need to have the mechanism in place to clean that equipment before it's passed around others. So whether or not that is bacterial wipes, or whether or not that is a bucket of disinfectant. But our recommendation is that it is easier to plan activities without equipment than to try and wash and clean equipment as it's passed around a group. We also recommend that we stay local, that we avoid activities that require our participants to travel. Any travel increases risk, whether that's risk of bumping into people on public transport or just mixing individuals from different communities. So if we can stay local within walking distance, that reduces the risk to everybody. As I said earlier, one of the required practices is that we require you all to do a risk assessment. There is an example risk assessment on the Woodcraft Folk coronavirus reopening page. In your risk assessment, we want you to include the risks to your volunteers, and that includes your volunteer capacity and the volunteers' understanding of what the new practice will need to be to make sure that we're managing infection control for coronavirus. So that's how do we make sure that we've briefed our volunteers? How do we make sure that we have enough volunteers to supervise children and young people? Our insurance requirement of having a minimum of 2 screened adults is still in place. Our recommended ratios for the different age groups is still in place. So we should have 1 adult to every 5 elfins, and we should have 1 adult to every 8 pioneers. Which would require us, if we're having groups of 15 children, to have 3 adults for our elfins and 2 adults for our pioneer groups, but also 2 adults for our venturer groups. It may be that a volunteer is fully committed to coming along, but they may develop symptoms, or it may be that they've had contact with somebody who's developed symptoms. So having reserve volunteers would be recommended practice at this moment in time. The other thing that you need to include in your risk assessment is your participants. And therefore we need to know about our participants and the true risk that coronavirus presents to them. So we need to understand if our participants are clinically vulnerable or living with people who are clinically vulnerable, and how we can reduce the risk. As an organisation, we will want to include as many young people as possible, and therefore we need to consider whether or not face-to-face activities is exclusive to some of the people who usually participate and attend our face-to-face activities. We also need to include what we're doing around infection control. And as I said at the beginning of this presentation, that's largely about maintaining good hygiene and making sure that we make participants aware that they shouldn't be attending if they have symptoms or have come across individuals who have symptoms. Now, the recommendation here is that if people have symptoms, they should self-isolate for 14 days. So if they come along to a group and a couple of days later they develop symptoms, they should tell us. So if they develop symptoms within 10 days of attending a group activity, we need to tell everybody who attended that activity that they may have had contact with somebody who is showing coronavirus symptoms. And until that person has a negative coronavirus test, all individuals need to self-isolate. So whilst we might feel that in the summer, coughs, colds, temperatures are lower, as we move into the autumn term when schools begin, it may be that we see a lot of people self-isolating with coronavirus type symptoms who don't have coronavirus but have normal beginning of term and winter seasonal tickles. Now there's a little question, let me just see. Sarah, I'm going to unmute you so you can ask that question, and then I will do my best to answer it. So I've unmuted you, Sarah, but you need to unmute yourself so we can hear you. Go for it, Sarah.
You mentioned earlier, can you hear me? You mentioned earlier about when they go outside, they stay in clans of 5.
Yeah.
But then you're saying, oh, we need to have the volunteer kind of, ratios. I don't understand how that is. It we stick to the clans of 5 with 1 adult, or we're with the ratios? I didn't quite get that. That may be just me.
I'll try and explain. What we're trying to one of the challenges here, there are lots of challenges, but one of the challenges is that if we have 15 young people, even if they're 2 meters apart, they may mix, which is great because that's what we want them to do. But the thought is, if we use a clan system, they won't mix with all 15. They'll only mix with another 4 young people supported by an adult. So for an elfin group, the ratio would be 5 elfins to 1 adult, which makes a beautiful clan of 6. Clearly, if you're working with older age groups, you might want to have slightly bigger clans. But the principle of trying to not make the whole 15 socialize with each other is what we're trying to encourage people to do. Does that make sense?
Yes, it does. Yeah, thank you.
So I mean, it's one of those really tricky things that we're going to tell everybody that they need to keep 2 meters apart. We're going to recognize that at some point they might be only 1 meter 80 centimeters apart, and if they can do that with less people, the risk is lower. So we're going to try and create clans or social bubbles within our group as we go through. And the clan doesn't have to be 6, but for the majority of our groups are elfin groups, and therefore that 5 to 1 ratio works quite neatly. The other thing around infection control and hygiene is this hand washing. And there seems to be a much greater readiness supply of hand sanitizer, which would be suitable. We are encouraging people in their risk assessment to consider whether or not you need to stagger your start so that people aren't all arriving at the same time and aren't all trying to wash their hands. But it may be that you have every clan leader with their own bottle of hand sanitizer and you feel that you can manage 5 people in a socially distanced way. Obviously, in our risk assessments, we need to include the things that we would usually include in a risk assessment around the venue and the environment. We are recommending that groups do activities outdoors, and outdoors will generate other risks. It reduces your risk of coronavirus, but it increases your risk of coming into contact with other members of the public, and it increases your risk maybe of being near water, being near roads, and other things within your immediate environment. If possible, it would be great to do outdoors, but in an enclosed area, such as a school playground or a tennis court or a football pitch, rather than a public park. Depending on the weather, public parks at the moment have been very busy, and therefore it may make it very challenging to manage your group of 15, particularly if there are other children and other families around who are interested and intrigued by what we're doing with our Woodcraft Folk group. Do recognise venues are going to be a challenge to find something that fits our needs. The other thing around our venues and our environments is access to bathrooms. We are requiring all groups not to do activities beyond 2 hours, but 2 hours is still quite a long time not to go to the bathroom for some of our group members. So being clear where we can access bathrooms, when those bathrooms are cleaned and how clean that they are, or whether or not we need to consider having a toilet tent put up, or whether or not we need to consider meeting for less than an hour to make sure that we don't need to require having to go to the bathroom at all. The other thing in your risk assessment is about activity and equipment. So we are recommending that you don't share equipment, and we are recommending that you don't do activity that requires close supervision. So doing knife work and some bushcraft activities with inexperienced children is probably not a good idea, although maybe doing knife work with experienced children would be acceptable, because you have to do that a little bit distanced at the best of times. You know your groups best, and we would recommend you choose activities that you feel are manageable. Before starting activities, we're advising all groups that they need to consult their members, and by members we mean the adult volunteers as well as the children and people and their families. We need to make sure that we can reassure people that we are managing the risk and that we're not taking any unnecessary risks with their health and safety. We need to be able to share with them our risk assessment and our plans. As I said earlier, we need to consider that we are being inclusive of all of our members. And if we feel that we aren't, we need to continue to do remote and virtual activities until we can include all of our members. You should be contacting your venues to see what steps that they're taking to safeguard. Every community venue and school venue will have a coronavirus action plan about how they're going to maintain hygiene and how they're going to increase their cleaning. And it would be good to know what the new procedures are. Many venues are introducing one-way systems. Many venues are introducing new sign-in instructions. Many venues are trying to have contactless systems to try and stop us all touching the same door handles, light switches and everything else. We may find as an organisation that venues are not accessible to us in the short term while they adapt and change and put in place the measures that they need to do to safeguard their users. You are required to do a risk assessment. If anybody wants any feedback on their risk assessment, you can email that to safeguarding@woodcraft.org.uk and we will give you feedback. There is a template, as I said, on the Woodcraft Folk coronavirus reopening page. You need to have made sure you've bought your PPE. There is a waiting list for purchasing most PPE online at this moment in time, although I'm told that Boots is a really good place to go and get your PPE in a hurry. You also need to have an isolation plan in place. So if somebody develops symptoms whilst they are in the middle of an activity, you have a plan in place about how you will manage that. Now, in the reopening guidance issued on the 18th of June, there is recommended practice in that document. We need to find somewhere where we can remove that individual from the group. The adult who is taking care of that individual needs to wear PPE, and we need to contact that child's parent, assuming it is the child who develops symptoms and not the volunteer, to come and collect them as soon as possible. We also then need to inform all the other participants that they may have come into contact with somebody with coronavirus symptoms, and that we need to recommend that the individual with symptoms accesses a test through the NHS, and we need to await then to either have a positive or a negative test and inform the whole group. The whole group would need to self-isolate until they received a negative test, or for 10 days after the contact with the individual with symptoms. So if you have contact with an individual with symptoms, you should isolate for 10 days. If you have symptoms yourself, you should isolate for 14 days. We're also recommending that you have a volunteer agreement so that all volunteers are on the same page and have the same level of comfort level with the decisions that are being made. There are a few places where you can go to get advice and information. So the first website on here is the Woodcraft Vote website. On that reopening page, you will find template posters, you will find an example risk assessment, and you will also find a one simple page, A4 page, of what you can do and what safeguards you have to put in place, as well as the things that we recommend that you put in place. You will also find there isn't yet a template of a volunteer agreement, but I'm working on it. The plan is that there will be by Friday. Also on that reopening page, you will find the extended guidance that was circulated to groups in June, which answers all those questions about what do you do if somebody has symptoms, what do you do if somebody develops symptoms after attending a group, as well as the safeguards for what we do when we begin to do residentials, but that's unfortunately a way off in the future. The other website that is useful support is the Youth Work Support website, which is a partnership website between UK Youth and the National Youth Agency, who have pulled together various different guidance from the youth work sector as well as training, and it's a really good place to visit. In England, the National Youth Agency website is also a good place. Every week, the National Youth Agency is publishing a readiness level for youth work to begin. We are currently on the red level, which means that we can only do remote and virtual youth work and youth work with extremely vulnerable children and young people. That readiness level will change on the 4th of July to amber, which means that we can begin to do small group work, which is why we're beginning to do activities with groups of 15 young people. At some point, we will change to yellow and green. When we get to green, it will be business as we once remember it before the 16th of March, and that we can continue to do everything we did as we did before. It may be some time before we get to green, and it may be that we go both up and down the colour spectrum, depending on infection levels. We also need to make sure that not only do we consider what's happening from our national regulatory body, but also what's happening in our own communities. And if in our locality, lockdown is being tightened because of infection levels, then we need to cease face-to-face activities. For those members who are in Scotland, YouthLink Scotland have very similar guidance to the National Youth Agency, but it is tailored quite obviously to the Scottish Government approach to lockdown easing, which is slightly more gentle, shall I say, than what's currently happening in England. And at the moment, we are hoping that activities can begin in a few weeks in Scotland as they move into the next phase of allowing sports and leisure activities. The other place to get lots of information is the coronavirus page for the government, which has everything you need to know about PPE, infection control, and how to report cases, how to generate a test, and how to involve their track and trace system. Cool. In terms of training from woodcraft folk, on Friday we are doing a webinar all about social distancing and how we can keep 2 meters apart, and when we can't keep 2 meters apart, how do we safeguard people in those situations. You can join that webinar live, or you can wait for the recording that will happen very shortly afterwards. There's also a short film about introducing safeguarding, which explains the responsibilities of our volunteers to safeguard children and young people. There are also various other training webinars which are relevant. One is about how to complete a risk assessment. One's about reasonable adjustment, as well as our roadmap to reopening after coronavirus. For those of you who opt to continue to do remote and virtual program, there is a webinar on staying safe online. There are also various other webinars on inclusion. Some of those are focused about including young people with additional needs. Others are focused on how do we deliver our aims and principles, and including how do we deliver our aims and principles online. Now, I wonder if you have any further questions or comments. As I said at the beginning of this webinar, we are all required to do risk assessments. You're all required to make sure that we have a register in place for all of our participants. We can't do activities for more than 15 children, and that we need to make sure that we have hand washing facilities available on our venues, and that we've considered inclusion, as well as how do we manage things like toileting and access. Now there's a question. Are there any questions at this time? Maybe not. Does anybody have any questions? If you don't have any questions, look away. Oh, actually, no, I might just go back and recap. Oh, I can do that like this. So whilst you're thinking about your questions, just to recap, these things are the things that you are required to do before the activity participates. So there must be a risk assessment. We must display the signage. We must have hand washing. The group of children and people can be no more than 15. We need to have a register, and that includes the adults as well as the children and people participating. We do need to do social distancing, and we must have PPE already in our first aid kit. On top of that, our recommended practice is outdoors. We think outdoors is best. Clearly, the risk levels are much lower. If you are doing wood chips and young elfins, we recommend that you focus on families and households. Now, if you're doing families and households, you can still only have 15 children at most, but you shouldn't have more than 30 participants. So you may need to consider how you do that if you have a large group. We recommend trying to create clan groups within your group of 15 to try and prevent households mixing more than necessary. We recommend no shared equipment. As I said earlier, if you do share equipment, then you need to have a process in place to clean that equipment as it is shared within the group, which could be just a bucket of disinfectant or wipes. But I'm personally not keen on creating extra waste with wipes. And staying local to avoid travelling and therefore avoid risk for the families and the children and people getting public transport and moving around. If you have no more questions, I will end the session. Oh, Ros,
no, I have. Can you hear me?
Pippa, go for it.
I typed a question. We've got 21 in our Elfin group. So if you're saying you can't have more than 15 children, but you need to consider inclusion, would you then recommend splitting the group in half and doing 2 separate sessions?
If you feel that you have the capacity to support 2 separate sessions, yes. At this moment in time, the guidance we're getting from the National Youth Agency is that we shouldn't be doing anything bigger than 15 children and young people, because it is about small groups only. If you feel that you don't have the capacity to run 2 separate sessions to include all your Elfins, then you are better off waiting and continuing to do online session, although I recognise online sessions with Elfins have been a struggle for every district.
Okay, well, we have been doing them.
Does that answer?
Yes, I think so. Yeah.
I think that, yeah, I suppose the other thing is there would also then need to be cleaning and stuff after that. If we did two sessions, you need to clean the premises, you know.
No, but if it was outside.
Oh, outdoors, yeah. Okay.
I mean, we recommend outdoors, although technically you can now do activities indoors. But yeah, if you did outdoors and you were using ground sheets, for example, to create places for them to sit, they would need to be mopped down between the groups, yes. But if you were doing running around games outside that didn't involve any equipment, then there's no cleaning because it's the beautiful outdoors.
Yeah. Thank you, it's helpful.
Thank you.
Cool. Ros, you've also just typed a question. I'm going to unmute you so you can ask us all. Ros, I've just unmuted you. I thought you'd asked a question. You're not there. Ros asked a question about bulk buying PPE. We have looked into bulk buying PPE, and the distribution costs to get it out to all of our groups actually means it's not a cost-effective thing to do. But we can share where we have found affordable PPE. Although it is true, if you're willing to visit eBay, you can get it cheaper, although you may have to wait a few weeks for it to arrive. Were there other questions? So somebody's just asked, will they have the slides? We'll attach the slides to the email to all of the district groups and leaders, and the recording will be available for people to watch again as they go through. Okay, if nobody else has any questions, I will say good night to you all and end the session. If you have any questions or you're struggling with your risk assessment or need help, please don't hesitate to email safeguarding@woodcraft.org.uk and we will do our best to help you. If not, you can visit woodcraft.org.uk/COVID-19-reopening, and there you will find example templates there. So thank you all, everybody. If you want to find out how do we do social distancing at 2 meters, including suggested activities, and what do we do and how do we manage circumstances which require less than 2 meters, that webinar will be recorded live at 6 o'clock on Friday.